Yep.
Sorry, I realized I forgot to get some information from you.
It's okay.
So Fuzz was male?
Fuzz is a boy, yes.
Okay, has he been neutered?
No.
And then what breed was he?
He is a teddy guinea pig.
Okay. And what color?
He is white with black and brown. There he is. Yeah.
Okay, he was that one that was just moving right there? Oh.
White with black and brown.
Okay, and then do you have a birth date for him?
No, I don't. He's probably about 4.
Okay. Alright, they'll be right with you.
Thank you. So I'm at the vet with poor Fuzz. I noticed he wasn't eating yesterday. He didn't want his carrot in the morning, and that may have really saved his life because I noticed that he didn't want to eat, and then I smelled his breath and it smelled kind of foul, so I took him to the guinea pig rescue. Saskia said that his teeth seemed a little bit overgrown and trimmed them, but wasn't sure that that was actually the cause of the problem. So I was able to get an appointment at my vet here at Chaparral, and we're gonna see if we can get to the bottom of it. Maybe I'll get an x-ray. So we are gonna do an x-ray. Dr. Llewellyn doesn't think his teeth are bad or that is actually the issue. Something else seems to be going on. So we're going to do that. She seemed to approve of the measures that I took, which were I gave him a little bit of Bactrim yesterday morning, night, and this morning because his breath smelled very infected and he just seemed overall uncomfortable, and I didn't want to wait a whole day. I wanted to see if I could get something going, and she also thought that the Medicam for pain after the tooth trim and in general was prudent and not out of bounds. So I feel good that, you know, I'm sort of covering my bases, but I think the x-ray may or may not reveal something. Saskia really squeezed him and tried to feel for tumors or lumps or anything like that. So we'll see if the x-ray reveals something. Yeah, but you don't see any tumors or?
No. I do feel thickening of his left jaw, and so
Could that be like arthritis related, or?
it could be that there is a root issue, but it's not an abscess yet, and
I
it's
see.
especially if she felt like there was big spurs or
Yeah.
spurs inside the mouth. What are his stupid roots doing?
Yeah. So I guess that's the question: is this the cause or is this the symptom?
Right.
Right.
I'm not good at answering that question.
Yeah. This was amazing. Are you gonna eat some? Fizz came running when I brought the lettuce in. I don't know how much he's able to eat. Come on. Yeah. But having a willingness to eat and not really being able to, that shows that it's a tooth issue. Even though tooth issues are really difficult to deal with, at least knowing the problem, and we have a plan. Gonna try to eat it? All right, I gotta give everybody their lettuce. Everyone's going crazy. Fuzz, here, try some. This is a good sign. Maybe I can slice some carrots into little pieces. Do what you can, buddy.
He's just trying to get out of... I have a whole thing of critical care all ready to give him in a few minutes. Do what you can, my man. My poor Fuzz. He's had a tough couple days. But I was really heartened to see him run out just now. I wasn't filming because I was just giving everybody lettuce. Yeah, he looks tired. But considering how little he's really eaten over the last day and a half, he does seem to be pretty, he's got a fair amount of spunk. So I have critical care here, but first I wanted to try just some veggies. And I also have banana. You want to try some banana? Now that my hands are all slimy. Here. The more you eat of this, the less critical care I have to force on you. But we will sit here, right, BB? We'll sit here and do the critical care if we have to. Which I mean, we've got to do some anyways. Here, try some carrot. Come on. He's pretty sick of me. Try the lettuce. Come on. Don't worry about me. Don't worry about me. But I think it's a typical tooth situation. His teeth didn't seem long, but there's something that's causing him pain because he ran out like he wanted to eat, and then it was like he realized that he's having trouble. So he is going to be on. Oh, and you know what? I've got to give him some gas drops. Also, because he's probably pretty uncomfortable. So gas drops. Maybe I'll front load him with the gas drops. Give him some gas drops now, so that at least that's in his system before he gets too much critical care. But either way, we've got to start filling his belly with food. And in general, when piggies are bloated or they have gas or whatever, you don't want to give them too much veggies, in my experience. But it's also important to give them whatever they're willing to eat, a little bit. And then, of course, as soon as you can, really transition them back to hay. Because hay is 80% of their diet. So that's why the emergency food is important, because that's pretty much basically just powdered hay. I hate seeing you like this, Fuzz. Okay, so I'm going to get the gas drops, and then we'll syringe feed him. Okay, so also, I gave him about 15-20 minutes ago, I gave him CBD on his ear. It's already absorbed. And I gave him some Medicam. That's the Medicam, Meloxicam. That was Mateo. So now, I probably have one open somewhere. But what's nice about these is it comes with a syringe. It's kind of a flimsy one, and piggies will chew on it. Don't jump. You know, it's also really fun. I have this cut, which I don't even know where it came from. I have this cut on my finger, and it's right where you like pull the syringe. It's right where you do everything with your finger, but That's how it is. Okay, so we shake it, mix it up. It's sealed. That's good. Ow. And you can find this in the baby section, like in a place like Walmart or something. They'll have like a whole baby section where it's like baby food, Pedialyte, like baby blankets and bottles and all that stuff. Okay. You can be pretty liberal. Some people will say only 0.1, 0.2, 0.3. And you can do it pretty frequently with really not much downside. I would start with around 0.3 generally and do that every 3 to 4 hours, depending on your pig and what the situation is. I'm going to give him 0.5, really like half a syringe, because if you saw that, well, we saw that X-ray, and he is full of gas, and this stuff is very safe, right? They give it to babies, so he's sick of everything though. So this stuff actually smells really good. It doesn't smell like all medicinal. You just got to be patient when you're syringe feeding. Come on, buddy. He's sick of it. He's sick of all of it. Come on. But you do this, even though he doesn't like it, you do it because it's good for him. It's what he needs. Come on, buddy. So you just gotta be patient. Try to go on the side. Come on. I know. And it is what it is. It takes how long it takes. Boom. And then look, did he get most of it? Good boy. I'm sorry. That's just the beginning. You know, normally when piggies have tooth issues, they're voracious. They want to eat. So what this is a mixture of fine grind papaya and emergency aid, Aid IC, and it's going to spill everywhere. Uh-oh. Okay, there he goes. Oh, sorry, BB. BB, here, you come on top of my head. BB, up. Okay, you sit up there so I know where you are. Yeah, no big deal. I just have a bird on my head. It's par for the course around here. Okay. Now, I may need, when I hold him and I'm not filming, I like have my knees behind him so he can't like just go backwards. Demonstration purposes, it's harder, so I'm kind of holding his butt like this. And piggies often have a natural instinct when you pet their nose to push their head up. And if you can use that to your advantage when they do that, then you just put the syringe in. You should just taste it. I also put some Child Life liquid vitamin C in here. Just taste it and let me know. You know, how do you know you don't like it if you don't try it? Oh, bird. What are you doing up there? Okay, come on. So, you don't want to go too much. at a time. This banana is making everything gross on this fleece. So I need to get 10 minimum into him. And if it ends up on the fleece, then that doesn't count. Sometimes piggies will, when it's waterier, they'll take it. I know this is kind of turning into a long video, but I hope that it may help people to see how patient you've got to be, you know, and what the technique is. And even with all my experience sadly, at giving meds to guinea pigs, sometimes they just don't want to take it. Bird, did you just poop? What just happened? I just got a bird and poop on my head. No big deal. There we go. So that's 1 out of 10. And this fleece is already gross. If you want to eat some of this, now I'm hoping the antibiotics will start helping him, and that the gas drops will start helping him. And oh, bird, what are you doing up there? Look at all that dust. Something is going on with his teeth, and he doesn't feel good. So it's really going to be about emergency feeding and pain management. Getting this gas out and keeping him stable. And he hasn't pooped for a while, so I have Cisapride, which is a motility drug, and my vet said she didn't have any problem with me giving that to him. But if there's no food in him, then there's not going to be any... Oh, buddy. Oh, come on. But yes, it's amazing how strong he is and how much he wants to fight me, even though he hasn't really been eating. Come on. Fuzz, you know, I don't like doing this as much as you don't like doing this, but I love you, and that's why we're doing it. That's why. Yeah, this fleece is really gross now. It's all wet with shredded veggies that he didn't want to eat. So one tip that I gave, a guy came into the rescue on Wednesday, and his pig was having tooth issues, and I said, get every kind of emergency food you can. He purchased the Sherwood, but I also gave him some critical care. We had the apple flavor, I guess it was, and then I told him to get the papaya as well. That way, like, if your pig needs constant emergency food, switching up the flavors can really make it a lot better. But this is why I'm like really surprised that he wanted to eat the lettuce but felt like he couldn't, and now he doesn't even want to try this. Something's going on with his mouth. Like, he is swallowing it, but I don't know if maybe his cheek hurts, his throat hurts. The vet said she felt, you got carrot on you, she felt like a thickening somewhere. Not entirely sure which side. Come on. You know, Pedialyte also can be good when they're not eating much. They're obviously not drinking very much either. And pediatric electrolyte mix, Pedialyte, can really help hydrate them. You know, you think, okay, well, I'm giving them a lot of critical care, but really 10 milligrams is nothing. They really need, so you want to do this as many times a day as you can. Syringe feeding sick piggies is like a full-time job, and it sucks. But at the same time, that's how you bond with your pigs super hard. And if you can put a bird on your head while you're doing it, even better. BB, come here. Say hi. BB, Fuzz is sick. Fuzz is sick, BB. But we're going to take good care of him. Okay, come back up. Come on up. Ow! Ow! That's my only good finger. Come back up. 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 Okay. Alright, well, I'm going to just keep on syringe feeding him. Boom, boom, boom. So I'll do about half at a time and check to see if he like spits it out. I'm going to keep syringe feeding him. This is where we're at. I don't expect there to be an improvement right now. And I'll probably give him a little bit of cisapride at the end of this. And then before I go to sleep, it's already pretty late, but before I go to sleep, I'll try to syringe feed him as much more as I can. He's going to really, you know, you bond with your piggies. Some piggies, like, I think that he gets it, but I think he also is sick of it. Be mad at the illness. Don't be mad at me. Look, I got carrot all over me. And then you can go back with your bro. I love you, Fuzz. I love you. You look like a marshmallow. You look like a burnt marshmallow. Here, come here. I know, buddy. Here we go. Here we go. Ready? 1, 2. I have this other video. Come on. It's called Tooth Issues Explained. It talks about like how you get from having tooth issues to like recovering. I'll put that video here because I think it's really important for people to understand the process and the thinking behind tooth issues and how to get everything back on track, because there's a lot of moving parts and tooth issues can be caused by a bunch of different things, but once you've got them, you need a game plan, long-term plan. So please check out that Tooth Issues Explained video just so you have that basis of understanding for if you have to deal with it, which tooth issues are very common in piggies, and you got to know what to look out for and what the process for recovery is and why. All right. Until next time, thank you.